Is it hard to talk about it still? Like, does it drain you? Is it bring back a lot of emotions?
It can. I mean, in the beginning, before I did my first kind of publication with another like blood cancer charity, I was back and forth about whether or not I wanted to tell people
Yeah.
and kind of come forward. But I think in my heart, I knew it was the right decision. And like what we're doing here today was the right decision because there were a lot of patients I spoke with, or not a lot, but several who I happen to know that were around my age who were in similar situations, who, when we kind of discussed about advocacy and such, a lot of them they made that personal choice it wasn't for them. It wasn't something that they wanted to do because it is a whole nother challenge about
Yeah.
being open about it.
Yep.
I look at it like there's probably so many people out there like that I'm okay with doing it. In a way, it's like I'm speaking in a sort of for a lot of the issues that they have, and that's what kind of made it work for me. It made it the right choice.
Awesome. Let's talk a little bit more about support services specifically for young men. We talked about how it was difficult to maybe find some of the questions that you had, find a place to get them answered as it relates to, dating and family and life down the road. What specifically is it, though? Do you think about young men who are dealing with this? Do you feel like there's a lower level of support for people that fit in that category?
Yeah, I wouldn't say that it's intentionally being left out, but I think that just like a lot of other things, like I always think of, I have a lot of veterans and, military personnel in my family. You think about like veterans issues, right? Where you have these guys who are peak physical shape and they're Marines and soldiers and sailors and they go overseas and fight for the country, and then when they come back to the States, retiring from the service as a civilian, it's hard to talk about a lot of the mental and the physical toll that any kind of traumatic event would happen, to somebody like that. I did not do therapy necessarily during my cancer treatment, but I kind of wish I would have. Post treatment, years later, I've done some of that, and all of my therapists and social workers, that sort of thing, they have been extremely helpful. I kind of wish I would have done it earlier. I think that guys, especially younger men or even a little bit later in age in their 40s or 50s, it's okay. Like, I feel passionately about the stigma of I'm a guy, I'm gonna, tough it out. Well, I think that there's merit to that. I also think that, look, if going through something, it's tough and you should be able to seek support as you need. It's okay.
If somebody is watching this who has, whether it's a husband or a boyfriend or a nephew or an uncle who's in that situation, do you have any suggestions on how to help support them? Because you are right. I feel like men are less likely to ask for help or lean on somebody when they need it. Culturally, we've taught them not to do that. So how can you support a young man or somebody in your life that's dealing with this?
I would say it's a very difficult thing to process with the diagnosis. It's okay to feel down and to have these emotions regarding your mortality and regarding your inevitable life-changing course that these diseases kind of put you down. And it's okay to seek help, and nobody's gonna judge you for doing that. It's a little bit scary, I think, at first as a guy, like I said, opening up. As I was saying before, a lot of my friends from school and such, I kind of closed myself off a little bit because one, I felt like that maybe I didn't want to put the burden on them to feel like they had to do anything. But also because I also didn't want people worried about me. Some of the other patients I know, at least with my type of cancer, with Hodgkin's lymphoma, there were like two female patients I knew, and they didn't have that kind of like stigma holding them back. So they had a more open conversation with their support networks where they were able to get maybe some more support. And while we were going through the same thing, it was just like that's a great benefit to have. And I think as a guy, you shouldn't be afraid to pursue something like that as well. I mean, I just want other men and young men, to know that you can reach out. There are people, they're not going to hold it against you. They're not going to judge you. They will help you. Like I said, a lot of my therapists and such were really compassionate female therapists, and they help kind of guide me through the post cancer change.
I want to ask you a couple of quick questions about support and what comes after. When people are trying to support someone through any, medical condition or whatever's going on, oftentimes there's a lot of advice that is offered. Some of it's helpful, much of it is not. Is that something you experience? How would you guide people when it comes to that?
Oh, absolutely. I would expect many patients go through this. I mean, it could be a water cooler talk at work, or it could be a friend or a relative even, and usually it goes something along the lines of, oh, well, my brother-in-law's cousin's doorman's friend had a similar thing, and they drank this specialty, and, it cured them or it benefited them. As a patient, I did not like, personally, for me, I was not really fond of that unsolicited health advice. I think partially a big part of it was because I knew that it wasn't caused by like a lifestyle thing I was doing. Additionally, the doctors, the nurses, the healthcare professionals, like, they're really trying to help you.
Mm-hmm.
And if they're not recommending something, I don't necessarily trust some person who's not a professional to recommend something.
Yeah. And I imagine it can get sort of overwhelming. Many times now, no matter what somebody is dealing with, the first thing they do is they hop on the internet and they go down a very long, twisty, and windy rabbit hole into the deep depths of the worldwide interwebs. And they find all sorts of advice and do this and stand on one toe and put your finger on your nose and hop up at and then now you have people throwing additional stuff at you. I imagine there's a sense of overwhelm, and how do I sort through it? And really, you're saying at the end of the day, for you, the right choice was all of that is I'm going to put my blinders on. That's going to the side, and I'm going to follow the advice of my doctor.
Yeah, like, I don't necessarily think that people offering unsolicited advice or recommendations, I don't think that they're doing that maliciously or anything.
No, yeah.
But I was lucky enough to have a really good oncologist, great doctor, who shared with me everything I needed to know that I felt like. And I trusted her, and she trusted me that I would do my part in following her recommendations and such. That's just kind of what I stuck with. But it can be overwhelming, especially on the internet. The only thing I could offer to other patients is a lot of stuff online is just misinformation. Breaks my heart to think that people would do it, but there are sleazy companies out there that will sell you a product that promises all this stuff, but it's not FDA approved.
Yeah.
It's not being recommended by your doctor. And if it was so good, they would treat you with it. It's not. So you have to be careful as a patient, because you don't want to be just taking like random supplements online that you read about on Twitter or something. And the other thing is cancer is super complex. I mean, it's not a simple thing. Everybody's case is different. And what might work for somebody may not work for somebody else. So it's crucial to be skeptical of just different things you might see online or being offered to you by other people. 100%.
Let me backpedal a little bit, or backtrack is the right word. And I want to dive into some of the support issues that we talked about. One of the things that I think, and you have talked about, people considering as they decide whether they're going to talk about this publicly or how it affects their life down the road, is employment, and whether or not them putting this out there or telling their boss or, whomever is going to negatively affect maybe their insurance coverage, right? Do you now have a pre-existing condition, and their employment? I know that there are some protections that are woven into the Americans with Disabilities Act for people that are going through this. So can you talk a little bit about that?
Yeah, so from, and I'm not a lawyer or employment specialist, but from my understanding, the Americans with Disability Act covers patients and survivors caregivers, no matter what kind of cancer you had, no matter if you're in remission or not, for the rest of your life. And it also covers a lot of other disabilities as well. And that was really, from the way I understand it, was enacted to help protect people from workplace discrimination. That's not necessarily something that I can say that I dealt with, but that was definitely something that crossed my mind. And unfortunately, I think that it does affect a lot of people, and it's wrong. I think patients and their families and their support system need to know their rights, because if you are sick for reasons outside of your control and you're relying on your workplace health insurance to help cover your treatment, again, I'm not going to necessarily name anything, but I would say I would not be surprised if there were companies out there who would see that as a liability and find a reason to get rid of you. And it's sad and it's really aggravating to me. And I want patients to know you have rights, you have protections, you can utilize the FMLA, the Family Medical Leave Act, as well as I think even your caregivers could potentially utilize that as well. Because the last thing you want to do is you get sick for reasons outside of your control, and then a company gets wind of that, and then they go, oh, Chase is going to run up our health, insurance premiums this year. Let's just get rid of them. Or even just as simple as getting passed up for promotions because, oh, Chase has to leave work early, and while it's a protected thing and it's not necessarily discussed with other colleagues, they might use that against you to potentially not promote you or to not give you that raise you deserve.